Wounds can be open with broken skin and exposed body tissue, or closed when there is damage to tissue under the intact skin. And we think that's a good representation when we talk about DTIs in the pressure ulcers or decubitus ulcers. Now, near everyone will experience an open wound at some time in their lives, but the level of severity will range significantly depending on the type. You have penetrating wounds, and penetrating wounds are punctured wounds, surgical wounds and incisions, thermal, chemical, or electrical burns, bites and stings, gunshot wounds, or other high-velocity projectiles that can penetrate the body. Now, blunt force trauma, such as abrasions, lacerations, and skin tears. Now, closed wounds are often caused by blunt trauma. And though the injured tissue is not exposed, there can be bleeding and damage to underlying muscle, internal organs, and bones. Especially you can notice when there are such things as when you have fractures. Fractures damage internal organs and blood vessels, depending on where the fracture is located. We also know that you can have bleeding on the inside. Yesterday we talked about types of bleeding that you can see in the skin, right? And what were those we talked about yesterday?
Petechiae, ecchymosis,
Petechiae, porphyria, ecchymosis, and all that stuff. You can also have such things like hematomas,
yes,
right? Abrasions, excoriations, all of those are skin breaks. Now, we also look at the major types of closed wounds. Now, they're looking at wounds in two categories. Wounds that are closed and wounds that are open. Now, the major type of closed wounds, contusions, which is a blunt trauma causing pressure damage to the skin and or underlying tissues. Many times you hear that persons get a contusion, right? But you don't really see area that is really broken, but you know that there's an underlying, because you can maybe see just some slight reddening or discoloration that may happen to a person who have a contusion. The skin is not open. All right? Same thing goes with blisters. Stage 2 of the decubitus ulcers is a blister. We always stage blisters that's caused by pressure as a stage 2. Because when the blister pops, which eventually will pop, you get to the what? The dermal layer. You're not going down to the subcutaneous, but you have broken what? The porous layer. So the dermis go to what? A stage 2. Because stage 3 passes through the dermis into your subcutaneous tissue. So when you have a blister, and that blister pops, just the dermis gets. But once it's still a blister and hasn't popped, you're still going to stage it as a stage 2. Not 1. Stage 2. Guys, are with me?
yes,
A blister is not a stage 1. Stage 1 is just a redness, an unblanchable redness. That is when you press it with your fingers, it is not going to blanch, it's not going to get white. It's going to stay red. That's why they mean that unblanchable. So that's a stage 1. So blisters are stage 2, regardless of if it's gonna break open or not. It's still gonna be stage 2. Now the next is what? Seroma, which is a fluid-filled area that develops under the skin or tissue. Then you have a hematoma. What I want you guys, because you know what a hematoma is, right?
Yes.
Big off with blood. But you may not be very familiar with seroma. And look at the difference. The seroma is a fluid-filled area. While the hematoma is what?
Blood. Food.
Blood. Because blood vessels has been damaged and that causes bleeding. Why do you think they call it seroma? Think about the fluids. Serous fluids. Serous fluids, seroma. Okay? And of course you have crush injuries. If you got somebody stepping your foot or car you over the foot, you may not have an injury to the top, but you have injury on the line. Okay? So it's not open. So these are major types of closed wounds. Now, I see the put include, meaning it's not an exhaustive list. Now let's go to the ulcers. Here we talk a lot about ulcers, right?
Yep.
The Cubitus ulcers, stasis ulcers, ulcers.
Peptic ulcer.
Right. Here are a lot of different ulcers. So, now we said ulcers are a third type of wound of which there are 4 main types. Pressure, venous, arterial, and neuropathic. Venous and arterial ulcers are vascular wounds caused by problems with the circulatory system. As their name suggests, they result from insufficient blood flow to the veins and arteries respectively. Now both types are painful, most commonly found in the legs or feet and can lead to infections such as cellulitis. Let me ask you guys who mentioned what? PAD and PVD yesterday, right?
Yes.
Peripheral artery disease and peripheral vascular disease. So these can lead on now to ulcer formation. Neuropathic ulcers, on the other hand, may be painless because they arise from minor trauma, not noticed because of a loss of sensation, known as peripheral neuropathy. Peripheral neuropathy interferes with the ability to sense injuries, leading patients unknowingly placing stress on a limb's pressure points until an ulcer develops. Diabetes
Is the most common cause of
is the most common cause of peripheral neuropathy and neuropathic ulcers. Now, if peripheral vascular disease is also present, there is greater risk for infection and amputation may sometimes be necessary. Remember yesterday I said we talked about the peripheral artery disease, the peripheral vascular disease. Now with the neuropathic, you know when persons have diabetes, they lost the sensation down to their feet. And people put on the shoes, and the shoes may be damaging their feet and they don't know because they're not what? Feeling. And they will continue, especially the ulcers in the bottom of their foot, they don't look at it. So with time, that ulcer becomes bad and they don't even know it exists. And strange, you may see an ulcer that's like a stage 3, and the person don't know that they have a stage 3 ulcer to the foot. Because it might be in just under the hallux. Might be in the metatarsal area under the feet. Most persons, when they don't bathe, they don't really go under their feet. So they don't know what's happening down there because they're not feeling anything. When a person got some sensation, they will feel like, something is wrong down there. That's why diabetics, diabetes is a serious problem. And if you listen to the news, you know there is a rising in diabetes in the United States. There are more and more people who are getting diabetes. Right? There are diabetes mellitus. Now try to link what you just talked about with what you did yesterday with the PVD and the PAD. Once these things turn into ulcers, it's very difficult to heal these ulcers. Extremely difficult. Right? And diabetes. When you get diabetic neuropathy, when you hear diabetic neuropathy, always think that what? Loss of feeling. Anytime you hear diabetic neuropathy, loss of feeling in the extremities. And if this is combined with peripheral vascular disease, they don't know what's going on. Alright? That's going to lead them to a bad case of ulcers. A possible amputation. Now, other wounds that often require medical care are those that now they say that other wounds that often require medical care are those that are a result of significant force or trauma. And what can give you significant force or trauma? What type of situation?
Accident.
Car accident. Falls from a height, fall off of a building. Okay? Those can give you a lot of trauma. Or being hit down by a bicycle. You heard that this big star who got hit down by a guy on one of those scooters, and she passed away. So those guys who ride those electric scooters around, they hit you, you can die. You can get massive injuries from that. Now you have also, you bleed persistently despite pressure and elevation. What do they mean by it? The bleeding is diffuse and is consistent despite pressure and elevation. What do you think? What do you understand from that statement?
If you put pressure, it's still going to bleed.
If you put blood pressure.
Direct pressure, like your arm.
If you apply
Direct pressure.
what?
Your hand, like your hand.
With your hand? Why don't you use a bandage?
Okay,
Why don't you use direct pressure? Right? Because most likely you're not going to use your hands to just apply pressure. That can be a very emergency situation when you don't have what?
Supplies. Equipment.
Because even if you got a shirt or some type of material on, you're going to use this to apply pressure. But when you apply the pressure, you're going to what? You're going to wrap it. Because if you just put it on top, and you maybe just press your hand, that may not be enough to maintain. So you may want to apply more pressure. And to get more pressure, you wrap it and you pull. Okay? And that's it, going to apply more pressure to the area. Now, the patient may require what?
Stitches to close.
Use the word stitches. What's another word you can use? Sutures. Because we don't usually say stitches like that. Like you say patient had sutures done, right? These are caused by animal bites. But normally within the city, what type of animal bite you think you're gonna get?
Raccoon.
Dog. More likely it's gonna be dog bites.
Or cat.
Cat bites, right?
Rat.
Some people get bite with rats in their apartment buildings. Right? But those are the common stuff around. You're not gonna find in New York people being bitten by snakes, alligators, and that sort of stuff. But if you're living down in Florida, you're more likely to be bitten by snakes, especially your butt. It's on the toilet, and the snakes are in the toilet. And if you're on a swimming pool, it's the alligators usually don't like to hang out in the swimming pool. By the way, guys, this past week on the news, they called the police because they saw an alligator with a hand in arm in his mouth. Florida. The police was called because they saw an alligator with an arm in his mouth. So,
How you going to Florida?
Florida is a nice place. Florida's not bad.
You like it?
Too much earthquakes. I'm going there.
And also you require medical care of whom that cannot be easily cleaned.
Cleaned.
Can be easily cleaned. What can make something not easily cleaned?
Because of how deep it is.
How deep it is.
Right.
What else?
Infection.
Look at what's the top. All the wounds that often require medical care are those that. Some wounds we can take care of at home. These wounds that they're talking about, you have to get medical care. So what do you believe that cannot be easily cleaned by you at home?
Like a fracture. Right?
So, let's just keep it to skin wounds. I'm not going that deep. A burn?
A dry wound, yeah. Chemical wound.
Chemical. Bitten by animals.
Animal bites.
But think about a wound that might be
Infected wound, yeah. You said already?
No, they said cannot be easy clean.
Now remember, when they're talking about wounds in this category here, they're talking not about chronic wounds. Because if somebody has chronic wounds, it means that it's been taken care of along the way, right?
Yeah.
These are acute situations, like something to happen. And you can't take care of it at home. Because you gotta go to the medical center. So, what I'm asking you, what can it be easily cleaned?
Like a deep cut.
A deep cut.
A deep cut burn.
Think about a person who might have been injured with instrument, a knife, a machete, whatever it is, and it has a lot of debris, like stuff getting to it, like sand and that sort of stuff. It may not be deep, but it has other foreign body in the wound itself.
Yes.
And that, when something is a foreign body in a wound, the wound will not heal. So, you definitely need to go where it can be cleaned, because you cannot easily clean out that area. Okay? Remember, it's not just saying it's a cut, but what is in the cut that make it difficult for you to clean. Now, surgical wounds are cuts or incisions in the skin by a scalpel or drain plane during surgery, and we kind of talked about that yesterday. They are usually closed with sutures but are sometimes left open to heal. Now, surgical wounds are classified into one of four categories. You have class 1, 2, 3, and 4. Now, depending on how contaminated or clean the wound is, the risk of infection of where the wound is on their body. Now, signs of infection after surgery include increased pain, redness around the wound, delayed healing, a weeping wound, or the presence of pus or a foul smell. Having medical issues like diabetes or weakening immune system can increase a person's risk of developing a surgical site complication, as well as smoking increased age of obesity. So let me go back over that, because it became kind of like mixed up what I was reading. Having a medical issue like diabetes or a weakened immune system can increase a person's risk of developing a surgical site complication, as well as smoking can be a problem, person's age, obesity, emergencies, abdominal surgeries, and surgeries that last longer than 2 hours have a high risk of infection. So the longer the person stays in the operating room, high risk for infection. Abdominal surgeries. Remember the abdomen. Why did we talk about the abdomen that, makes it so concerning to us? And why we mention it here? We spoke about this before. Peritonitis.
Oh, yes.
The abdominal area becomes what? Infected. Remember, the peritonitis is when you have the bone-like abdomen. You have guarding and all that nice stuff.
Yes.
You have decreased bowel sounds. You have about the peritonitis, guys. When we did GI and we spoke about
Peritonitis.
the gastric ulcer perforating the what? The stomach.
Yes.
And we said the stomach gets into your abdomen, you can get what? Peritonitis.
Peritonitis.
So now, instead of it going through the stomach, some surgeons have to open up your belly. And there might be some kind of infection because of that. And the longer somebody is doing surgery, the more high risk of something happening. If it's 1, 2, 3, the risk is decreased.
Yes.
But the longer you go, things can happen.
It knows.
Alright? And the person can become infected. And I know a lot of you had a lot of oohs and ahs when we looked at the abdominal, the laparotomy. You guys remember the laparotomy? When we talk about abdominal surgery, which is called laparotomy, and then we look at dehiscence, when the sutures got what? Opened up. And then you had evisceration. After the sutures open up, all the belly stuff came out, all the bumps and what have you. You guys remember that?
Yes.
Well, that's what you're talking about here. The wound can become infected, the sutures can just open up, and you end up with dehiscence and evisceration. And one of the areas that you really want to look at is this abdomen way, because the abdomen got all the poop and everything that's in your body that's nasty. Okay, so you don't want anything that's wrong with the abdomen. Now they say chronic non-healing wounds are those that fail to progress in a timely manner, usually within a time frame of 4 weeks to 3 months. Look at that, what they say there. Chronic what? Non-healing. You know, back where I came from, they used to talk about life sores. Why do you use the word life sore? Because that person seemed to have a sore that they have it for them, since everybody knew them. And they get it to be for old people in the 40s, 50s, now they're in the 70s and 80s, and they still have that sore in their leg. So people call it life sore. But we know it is something different.
Yeah.
We know it is something as peripheral vascular disease. Right? We know it as stasis ulcers. We know that this situation with these type of ulcers, because of poor blood supply, these ulcers is going to take long to heal.
Yeah.
Or never heal. Because of where you are. If you're maybe in America, you can get debridement and this and that and all kinds of stuff. But back in those countries, you don't. People just have the ulcer, then they bind it into it. all kind of filthy stuff, because they can't have access to sterile bandages, because they can't afford it. Okay? Now they said there are, I got to take this up to the top. Now there are many factors that contribute to chronic non-healing wounds, including systemic illnesses, age, and repeated trauma, as well as conditions such as diabetes. See, diabetes comes to be a big guy. You guys need to look at diabetes inside out. Stay focused on diabetes, because diabetes causes so many different problems within the body. And cause so many complications. Remember I said except for the HDM, look up complications? All the complications related to hypertension. Also look up all the complications related to diabetes. You will come across a lot. You need to read up on these things. Okay? Alright, so diabetes. Anemia. You did anemia the other day, right? How do you think anemia is going to be a factor?
The oxygen.
Not only carries the oxygen,
Nutrients. Necessary for
not have
healing.
enough of these blood to carry it.
Yes.
No healing.
No healing.
Slow
It's
healing.
going to be retarded. Slow down, right?
Yes.
Then cancer and other long-term medical conditions, including
Arthritis.
and kidney
Disease.
disease. Why do you think they put arthritis in there?
We told because of the
That's
water.
not the ones. But you see, always remember when you're reading your questions, when you're doing your NCLEX, always read what they want. There are many factors that contribute to chronic non-healing ulcers. So what we're talking about is what?
Non-healing.
Ulcers that have been around for a long time. Chronic, a long time, right? And for a long time, it's not healing. Including systemic illnesses. Systemic illnesses that can have this occurring, meaning that illnesses that are factoring in the entire body, like diabetes. Diabetes is something that affects the entire body, right?
Yes.
Age. Well, I tell you, age is everything.
Yes.
And repeated trauma, if you keep getting repeated injury over the same thing, then that could be a problem, as well as conditions. And these are the conditions we mentioned. Diabetes, anemia, cancer, and other long-term, including arthritis. Why they put arthritis with those conditions up here?
With arthritis, I believe. I'm gonna take a stab at it.
No, don't stop it, man. It's probably gonna kill it.
This is my educated response to it. I believe with a person that has arthritis, they're not active. They're not active people. So you need to be active in order to promote the blood flow and all of that. And exercise is one of the required things that you need to do in order to
help you.
to help with the healing. So I think with a person who has arthritis, they're not motivated to be active because of the pain related to arthritis. So because of that, it will continue to make the chances for a person to heal
Which is a very
slower.
good response. That is exactly what it is. They also want to put in something there too with arthritis. Some people have what they call decreased mobility. They don't want to move around because of pain to the what? Arthritis is what? What is affected? The joint. So joint enables what? Movement. If someone wants to move around or walk around, they have decreased mobility, which is the problem. That's why they would throw that in. And then we saw also what? Kidney disease. Why are you picking up kidney disease?
So that's what fit.
It's not only
I'll take another stab at it. It's a kidney that filters the blood, right? So
the plasma go to the
and since you have a kidney problem, the blood being filtered is no good. So you're getting bad blood to go take care of the issues that you're having.
not bad.
I'm sorry, I meant to say.
It's not filtering the blood.
Yeah.
The kidney can't filter the blood.
So you have unfiltered blood.
Yes.
And then you look at the legs of people who are on dialysis. Don't you look what? God, back, what have you? Now heart disease, heart issues such as high blood pressure. We talked about that yesterday, right?
Yes.
And we've been talking about high blood pressure for a while. High degrees of varicose veins.
Yes.
Varicose veins. Why do you think varicose veins can be a problem? Come on guys, critical thinking. Why varicose veins can be? Why do you think varicose veins is up there? Conditions such as for non-healing ulcers.
That's what
Why
they are.
varicose veins?
That's related to PVD, right?
Yes.
It can be. But why varicose veins?
Low blood supply to the periphery.
No, because it's poor.
Guys, stay with it. You see, you guys are moving in the wrong direction now.
Okay.
Guys are doing well. We talk about non-healing wounds. Keep non-healing wounds
In your
in the
mind.
front
Yes.
and see how these conditions affect non-healing wounds. So how does varicose, we say high blood pressure, no high blood pressure is a problem, right? They say heart disease, definitely heart disease.
Varicose vein.
Because it's not, then how varicose veins is a problem.
Because they will be able to, for the blood to flow properly.
That's I want you guys to think first before you look it up. I want you to think. I want you to go back into your thing. Pull out those stuff. Critical thinking. Why? Just think about it. Varicose veins.
This is my initial thought concerning varicose vein. Then I'm gonna go look it up. But I believe when a person has varicose vein, it can come between the part that needs healing and where the blood is coming from. It could be like a blocked highway that's preventing the blood flow from connecting to the area that needs the blood, or you're getting limited supply of blood to that area that needs blood for healing. No, that's my initial
Here guys, that's not bad explanation. But think about varicosities. Where do you find varicose veins?
And the
the lower legs.
The lower legs.
Yes.
That's the only place you see varicose veins?
In the thighs.
I got you in it. They got it in the thighs too.
In the back, in your right here, in the waist too. Right here.
Yes, and your back.
Now, if you look and see what varicose veins is, it's an enlarged or dilated vein, right?
Yes.
What is a hemorrhoid? Look it up and tell me what's a hemorrhoid.
What is a hemorrhoid?
It's like a piece of your artist.
What is a hemorrhoid? Look up the definition of a hemorrhoid. So, swollen veins, which is a varicose, is hemorrhoids.
Yeah.
And if you have hemorrhoids, like you have bleeding hemorrhoids, internal, external, those hemorrhoids are varicose veins in your butt. And so what you think, feces come out of your butt.
Wow.
Feces touching those veins where the wound is, because what are we talking about? Non-healing wounds. So when a person has varicose veins that are damaged, they have to have surgery.
Wow.
Or else their healing is never going to heal. Because every time you go to the bathroom,
It's coming.
microorganisms from the feces is getting into it. It's never going to heal. Alright guys, remember, I know you guys start talking about the legs and varicose veins in the legs, because that's what you keep hearing all the time, right? People have women have varicose veins, increase it to the abdominal pressure is going to cause varicose veins. But you have varicose veins in other parts of the body. They just use the word varicose to say it's an enlarged vein. But it's not specific to just the legs. So when you go to your butt,
Yeah, we're good.
there's you will get hemorrhoids. Either internal that you can't see, or the external that you can see. When you can see it, it's a big fat vein that you're looking at. Okay? So that vein is not healing, is because of your what? The feces that's infecting it. Alright, next we go on to immobility such as being confined to a wheelchair or bed. Meaning immobility will be brought to arthritis also.
Yes.
Right? Immobility such as being confined to a wheelchair or bed. Decreased movement puts us at risk.
Yes, decreased mobility.
A lot, I know, let me put it this way. Remember when we were doing hypotension?
Yes.
I said people who lie on their back, supine position. In 3 days, what happened?
They get
can get hypertension.
scented.
And could include into the heart condition, all the different problems can occur. Right?
Yeah.
Decreased mobility
Yes.
is a problem. We were made to be active, moving around.
Walking around.
I always tell you guys Mother Nature. Mother Nature said what?
Sedentary lifestyle.
When the sun is up, you're supposed to be up.
When it's
When the sun is down,
We're supposed to be down.
bed.
that's right. You see the flowers, you blossom in. The daytime, they don't blossom at night. The birds come out and then
Sunlight.
the only thing that come out at night is the predators.
The worms.
The things who go looking for to kill and eat all the things.
The demons.
But Mother Nature, our body, Mother Nature's been taking care of it. It's we who step away from Mother Nature. So when this happened, we talked about culture the other day. Some cultures say you gotta rest when you, yes, you have to rest. You need 78 hours per day. But some people believe that on the weekend, they have to do what? Rest all the time of the weekend. Maybe it's a good thing, but it can be a bad thing too.
Yes.
It depends. You are training your body to do something. Okay? Resting you are today is what you have been doing for your entire life. Okay. Then you have harmful habits such as smoking and an unhealthy diet or, there you go. The same thing was talking about just now. Inactivity. Inactivity. And when you look at some of the younger people today, when you look at some kids, you look at the way they're built. You look at when they try to go from here to the car and just jog like. Now someone we're doing the what?
Playing video games all day.
Lazy.
We call it sedentary lifestyle is a big problem. Inactivity is something we gotta, with our kids. We gotta ensure that the kids develop a healthy lifestyle, which is not just sitting down in the house all the time. And you know what you need to look at, guys? How many of you look at American football on TV or on there? Well, if you look at the players who play for those teams, you're going to find the best players come from where? Africa. Haiti. Not here. Not in America. They come from places where they grew up doing things all the time.
Yes.
Not like how, so they're paying these guys big money to do what they're doing now. Look at it, even the big basketball stars. Check it out. Alright, moving on. We have next is what? A weakened immune system from chemotherapy, medications or medical conditions like AIDS. Well, we need not to go into that. We know that once the system is done, it puts you at risk for what?
Opportunistic diseases.
Why is one opportunistic?
Because it attacks your weak immune system. Because your immune from.
Anybody have payment? Anyone need to come see us? All right. Thank you.
All right.
Because you're really not strong enough to fight it off.
Why the word opportunistic? That's what I'm focusing on. Why do you use the word opportunistic? You just use the word, opportunistic.
Want to explain further? Well,
I want anybody to explain why you
I
think
can
the word
handle it. I can handle it. We call it opportunistic because it takes opportunity of the fact that you have a weakened immune system. So when it attacks you, you're unable to fend it off. So it's opportunistic because for a normal person with a healthy immune system, it won't do nothing to them. They'll fight it off. So it's opportunistic. It takes opportunity that is presented to the disease, whatever the disease is. I pass it to somebody
If you're
else.
walking in the street,
Give it up. Shot.
and you've got several people walking, and you see $100 bill, you can pick it up,
Oh yeah.
No.
or you can just keep walking.
Right away. Pick it up right away.
Right?
What?
What has been created?
An opportunity.
Opportunity for you to get $100 bill.
That's right.
You gotta make that choice, whether you wanna seize that opportunity
Oh yeah.
or not.
Oh yeah.
Same thing with diseases. Disease will see a situation, and they will say like, okay, let me take getting from this.
But if you
This is
don't,
they're getting on it. That's why they call it what? Opportunistic. When they see something that normally have a barrier, but now the barrier is down, they step in. It's like the door, like I close the door, right? If the door is open, you just walk in, right? That's an opportunity. But when the door is closed, you can't walk in.
it's me open it for.
So the diseases are like that, opportunistic. They need to get in on situations where the body don't have the what? The defense. system. So it's going to utilize that for their own benefit. Because what microorganisms do when they get into your body?
They multiply.
They replicate.
Replicates.
And when they replicate, means they become more.
Stronger.
Okay? Alright guys. And then you have infected wounds. Any break in the continuous skin puts the person at risk of infection.
Yes.
Because the skin is the what?
The first line of defense.
First and largest section of your body. Okay? So when that is broken, and when it's breaking, you know, if you do surgical procedure, it's called invasive procedure, right? Because what? You are invading. So if a person cut you with a dirty knife, they have what?
Infected your...
They have brought a whole set of infection into your body. That's an invasive situation. Anything can be invasive. If you give a person an injection, that's invasive. If a needle, you're walking in the street and something sticks you through your shoes, that's invasive.
Any break in the skin is invasive.
Anyhow it happened, it's invasive. Okay, whether it is mind control, which is the surgical, or is it just something that hits you like a mosquito or something, it's invasive. Because when a mosquito bites you, what the mosquito is going for?
Blood.
Blood. But why is it taking the blood? What is happening?
He's gonna die.
It might give now it's person.
It's causing the disease it has in its own body, it's passing on to you. The mosquito don't go to you to bite you to give you no disease. The mosquito go to bite you to
Give some
get
blood.
blood to live.
Yes.
But in their body, there's disease. The same thing now is what happened with you as a human person. You may have a disease, but you're not actively suffering from disease, but you can pass it on to somebody else, and that person is called a what? a carrier. Remember guys, in the microbiology, the people who have a disease that is not actively suffering from it, but can cause somebody else to get the disease and get sick and possibly die, that's a carrier. So those
You carry
mosquitoes are carriers of things, but we don't call them carriers, we call human beings carriers. We call them mosquitoes
Vectors.
vectors. Okay guys? Now circulation problems, we don't have to go through that because we know with circulatory problems is that all the problems you get is usually related to partial or total blockage of the circulatory system. Okay? And a history of ulcers. For those who've worked with patients who have ulcers, and we know that we cover patients who have like decubus ulcers, and decubus ulcers or pressure ulcers usually occur on bony prominences. You find that these ulcers may have a skin break, it heal up, but over that same area, you have another reopened wound. You find a lot with that. Okay? So it may now that that area that healed is at high risk for what? Breaking down because it's not as strong as the other areas of the body. Okay? And of course, certain medications, remember, is always a problem. And I shouldn't say that. Medications can be a problem, right? They have desired effect, and they have untoward effects. Okay? The adverse effects that you talk about, right? So medications can be a problem. Now signs of chronic non-healing wounds are similar to infected wounds and include pus. And we know pus is what?
Dead white blood cells.
We also use the word purulent, right?
Yes.
Redness or warm to rub the wound. So those, what's that? We have there.
Bad odor.
bad or
We have the redness or warmth. Right away we have two areas of what?
Inflammation.
Inflammatory response. Around the wound, a bad odor.
Increased
Increasing
pain.
pain, that's a third, right? Darkness skin at the edges and fever. Fever is the fourth.
The fourth one.
The one that you were missing there will be what? What's the fifth that's missing?
Warmth, pain, fever,
Loss of function is the fifth.
loss of function.
Depends upon where this is at.
Loss of function.
But you see, right away, you see all the inflammatory responses. Because remember, when a person has an infection, you may not see all five. You may only see 2, 3, 4. It depends on the severity. Okay? Now, usually when we talk about any type of disease in the body or systems or anything like that, you always want to look at complications. And I guess I tell you guys to look up for the complication related to hypertension. Right? Because you know, and you start from your head to your throat. Different complications. Not just diseases, but complications of that specific disease. Okay? Now, one complications. Let me just take this up. Most common complications from wounds is infection. Then we just talked about that, right? Now, if an infection goes undiagnosed or untreated, it can cause cellulitis. Which one did we talk about that can be undiagnosed and untreated? Which one did we just talk about? That can be undiagnosed and untreated.
Hypertension?
The what? No, you're right. What's more we got?
About ulcer, the
Neuropathic ulcers.
Ulcer, yeah.
Remember, the person don't know they got it, so they're gonna go see a doctor, so it's not gonna be diagnosed. It's not gonna be treated, because they themselves don't know they have it. Right? Because of loss of sensation. All right. Cellulitis, which which is a painful bacterial skin infection or spread on the line tissue on bone, a condition known as,
Osteomyelitis.
and that's what you gotta be scared of, especially with people who have what? Stage 4 decubitus ulcers. Because stage 4 means that what?
To the bone.
The ulcer has penetrated all the layers of your skin. It went through your epidermis, through your dermis, through your subcutaneous, through your muscles, and it gets to your bones, and it infects your bones. And anytime you see the word osteo, it's a bone you're talking to.
Related to the bone.
So osteomyelitis, infection of that bone.
Muscle.
Okay?
Interesting. That's what Maya was bones, muscle.
Infected wounds can also lead to sepsis. And that's a big one. All of the hospitals and nursing homes had this particular sepsis being taught to the staff. Because a lot of patients were succumbing and the staff did not know about sepsis. And when I say the staff, I just don't mean just the nurses, but general staff. Although sepsis is there, we know people can get sepsis, but the signs and symptoms of sepsis, the type of fever, people are not too careful, I would want to use the word, about the symptoms that were being presented, the signs and symptoms. So this led to problems in industry that lead to about 3-4 years ago that they complete all nursing homes and hospitals had to be go through that training. Now, which can cause organ failure? Absolutely, sepsis can cause organ failure, and in severe cases, death. Right? Because if we're finding quite a few persons were dying from sepsis. There's no persons who want to talk about septicemia and what have you, but it's not that. Now, when a wound has dead tissue in the wound bed, it is called a necrotic wound, and we know the word necrosis, right? Now, there are two main types of necrotic tissue in these type of wounds: eschar and slough. And you guys know both. You know the eschar, right? The one that's the hard coming that to the top, right? And then say we should stage the wound until that eschar has been removed. Before they used to call it a stage 4. Then several years ago they came up with don't call stage 4 because they have to pay more money for stage 4 ulcers. So now what they call it?
Unstageable?
Stage 4 ulcer. Until that eschar pops off, they can't stage it. Right? And the slough is all that booky stuff that you see inside of there, that you use that wound vac for to pull out. Now they said eschar wounds will have a thick, dry, thick, level coat that is often tan, brown, or black. Slough wounds are yellow, tan, green, or brown, and may be moist, loose, stringy. Now, necrotizing fasciitis is a flesh-eating disease that causes severe necrotic wounds. Necrotizing fasciitis symptoms include red or purple skin in the infected area. So when you see red or purple, you might think more of what? Purpura, right? Severe pain, fever, and vomiting. Now, necrotic wounds are unable to heal until the dead tissue is removed in a surgical process called debridement. And I'm glad you remember we were doing this, we talked about that football star who had the bone fracture. But what really happened to him was not a bone fracture that really kept him out of it for several years, I mean for a couple of years, was because the wound itself got infected with the bacteria. And the bacteria was not from the grass in the ground or something where the bacteria itself was located in his socks, the socks that he was wearing. At one time, everybody was talking about necrotizing fasciitis because if somebody got it onto the news and it see this man, parts of the body being eaten away and all that stuff. It's sensationalism, sensationalism is what make people read and look at TV, and that puts up the rating, and those people get a lot of money. Now, additional complications when hearing are
Periwound
dermatitis. It's a form of skin damage. Remember the term dermatitis. Then edema and periwound edema. Edema causes compression of small vessels and decreasing blood flow, increasing the likelihood of a pressure ulcer or injury. Now edema and periwound edema, went you back that again. Hematomas is a collection of blood outside of dehiscence. The splitting or bursting open of the limb, which we did before. Maceration is a macerated wound occurs when the skin is in contact with moisture for too long, slowing healing and making skin more vulnerable to infection. So guys, take a minute, look at those words: maceration, dehiscence, and try to get it into your
Maceration, I want to address it. And we'll do it.
so that later on we will not have a problem with it. When you see maceration, you know what maceration is. When you see dehiscence or evisceration, eschar, slough, you will know what all those words mean. And you can put it in the right context.
It's just...
Oh, you guys are writing something? You guys seem to write? If you don't seem to write, we'll give you a minute to write.
We should turn the light down.
Now they can't see it to write it.
We can't see.
Now they
Oh,
can't
I was looking on there to write.
Yeah.
Yeah.
I thought you guys were just researching anyway.
Can't draw the hair skin.
You can use the rest of the website.
Yes.
Copy and paste it.
All right, so let's move on. So we're moving up now to home care and recovery. Chronic, complex, and non-healing wounds are painful and can be debilitating.
If not treated,
Now the word debilitating, please remember that word. That's a word you use a lot when you're in nursing. It's a good word to use, especially when you're talking about condition, debilitating condition, debilitating sickness, that make that person unable to perform at their optimum level
Which word?
of development.
debilitating, the last word of the first sentence.
If not treated properly, they can eventually result in amputation of a limb, a severe systemic reaction, or potentially even death. So timely, appropriate interventions are necessary for a successful outcome. Basically what it's saying is that you don't waste time. Being timely is that you do things within a specific time. You don't put things off. Because the longer you wait, you can have wound degrading or deteriorating.
Thank you.
Now, Kindred Hospital, on that day, when you see Kindred Hospital, that is the people who put this up. So you know they put in their 2 cents
Of course,
for marketing.
of course.
Now, take an interventional approach, meaning that they don't just have a wound care doctor, wound care nurse, but they have the entire team is working. Now, Kindred Hospital take an interventional approach to creating comprehensive wound care
Plan.
plans. And you see what it says, wound care what?
Plan.
Plans, care plans. Care plans, the thing that you guys been working on, okay? There's an insight from specialists and extensive wound assessment that determine all factors contributing to and affecting the wound of each patient. Normally in those facilities, they will do wound assessment weekly, unless there's a determination that they have to look at it more often, but wound determination is done on a weekly
Weekly
basis.
basis.
All right, from when we come the next time, guys, the next week, you see that door over there? Please don't block that door where you're sitting, Sandra. We're gonna keep that door closed but open. So people who come late, don't come through over here, go through that door over there. And if you're gonna leave the class to go to the bathroom, also use that door. So you're not gonna interrupt what's happening in class at that time. We got it? When you want to leave the class to go to the bathroom like now, you don't come through here. You go through that door down there. Come late, you come through that door down there. Okay? Because it's breaking of concentration is not good for you, nor for me.
Or me. Oh, for real.
Okay, now let's go to, let me just raise it up, sorry. Some of the most common wounds we treat, we treat against Kindred Hospital, but some of the most common ones are
Surgical.
surgical site complications. And I like when they use the word complications, because as street nurses, I want you guys to always focus on complications. What diseases and their complications, because most times if you're going to be faced with an issue that the patient will be complaining of, because remember you go with your nursing diagnosis, is based on these complications. Okay? Now, open non-healing post-surgical wounds. So person had surgery and their surgical wound is not healing.
Possibly.
Localized incisions. Infected wounds and weeping wounds. I know what I said at the top. Those are the most common to you that the hospital takes care of. When you're working in the hospitals, that's what you'll be seeing. Pressure ulcers with complications.
Multiple stage 2s.
Multiple stage 2. Stage 3 and 4 will just occur. If a facility is found with a stage 3 or 4 that did not have before, that is, in the documentation, they had nothing going on, then all of a sudden you got a stage 3 or 4 that's reported to the Department of Health. Patients who have multiple stage 2s is also reported. That's why you see they mention it here. Pressure ulcers with complications. Because stage 2, multiple stage 2, tell you that something is going on. Why do you think so? Why do you think they want to pay such attention on stage 2 and not on stage 3?
Because if you take care of it when it's in stage 2, it's not going to lead to stage 3 or 4. You got to handle it while it's in the lowest
But when
stage.
you say multiple stage 2,
multiple stage 2.
Might be poor nutrient could make
Guys,
it.
also with complications, why is multiple stage 2 a complication?
Yes.
That's the question. Why is stage 2, multiple stage 2 complication? Critical thinking, guys. Come on. Why
Because
think that this is a complication?
poor nutrition could
Multiple
cause
stage
it
2.
poor nutrition, the patient not, they, yes, on position, they're not positioned, the patients could happen for multiple, stage 2.
Okay.
Yeah, that's right. It tells you, go ahead.
The patient not, the way she's saying, not be putting it often, or the dressing not being done like at the time it's supposed
That's right.
to do, so.
Poor
it's
care.
about this thing.
Poor care, yes.
So you don't want one and
And what the word you used just now is exactly what you're
Poor
looking
care,
at.
yes,
It shows that there is poor nursing care.
yes. Malnutrition, all that.
And I would take out the word nursing, sorry, that's picking up on nursing. But
Okay.
poor care by the health team, by that interdisciplinary team, poor care. But why nursing got picked on? Because remember, before you get to stage 2, you have what? Stage 1. And
Yes.
if you know that unblanchable redness over bony area is going to be breaking out, why you let it reach the point where it break out? If you notice it, so why? And then it's not just one, you have it multiple areas. So it means what? The patient is not being torn. The patient is being left in your what? Feces, a small way. So instead of just one area, you have it in multiple areas. They did not do the, what's it called, that thing that you do, what test, what's the scale you use? The B scale? For checking for pressure ulcers? Skin conditions? Alright, Gordon scale. Alright? Once you got a Gordon scale, you identify risk. Gordon scale will say you have a pressure ulcer, right? It identifies the risk for pressure ulcers. So when you pick up on the risk, you know this person can possibly get a pressure ulcer. So therefore what you have to do? Create a plan to prevent pressure ulcers from happening. Because the pressure ulcers from happening, in stage 1 is redness, then becomes stage 2, and now becomes a complication that's reported to the Department of Health. Stage 3 or 4, when you get stage 3 or 4, that's bad. That means that the ulcer has moved through from the what? Epidermis, and the dermis is starting to
That's a little muscle.
the next one is going to go into your muscle, but in the subcutaneous tissue, there's serious problem. Serious problem. Stage 4 is when it goes straight into the muscles. Pass through the subcutaneous tissue now.
That's been sepsis.
That's poor care, unless what?
Unless what? Unless
It will be considered poor care unless,
the patient.
I told you guys this before, just have to listen. I told you that ulcers are avoidable. Unless the doctor has indicated that patient has what? Unavoidable ulcers. And he has to put the determination why he says unavoidable.
Yes.
And at that time, I give you an ulcer. I give you something called Kennedy ulcer that have the terminal patients. Guys, you gotta follow up, please. I give you guys this stuff. Alright,
I have a questions, so a situational question that I'm actually currently dealing with. A client has an ulcer, right? That is right next.
guys, quiet please and just listening.
The client has an ulcer, right? Sacral ulcer, but it's right next to the anus. So, the caseworker is trying to talk to the client about getting a colostomy so that it can promote the healing of
Case
the.
worker trying to get the client to her.
Yeah, trying to connect the client with the doctor to have that conversation to get a colostomy surgery done, but the client is not actually the client's next of, is it next of kin, or what do you call it?
Healthcare proxy.
Right, and the client, which is a wife and whatever, they don't want to do it, so the situation is not getting any better. What would we do in that situation?
To maintain it.
And they refuse to turn.
How do you refuse to turn?
They don't want to turn, they want to watch the TV all day.
They wanna come out of the bed or?
What I'm saying is that, can the patient turn by themselves?
No, they have, from C4 to C4 to C5, yeah,
So, that means they're quadriplegic.
quadra, yeah.
So they're quadriplegic, and they have an ulcer is dependent on the staff to turn them. But the person's alert and oriented,
Very.
and the person but you have a healthcare proxy. You can only have a healthcare proxy if he's not making the decision.
He has an healthcare proxy, which is like a family member, which is a wife actually. But the thing about it is that
As a second opinion or?
he's always decided that he's undecided because the healthcare process always influencing the decision. So the situation
So
is
he's basically his wife.
exactly, and she's like, oh that stinks, we don't want that, and then he's like, okay, I don't want it to, and then later, okay, I want it.
And you have stage 4, large, very large.
It's pretty large. Like when I go and I try to work on it, it's like getting a little better, and then when I go home and I come back, it's like, whoa, this is yeah.
He's having to the sacral area, exactly where?
It's like this much space between the where if he defecates, it sips right into it.
Yes, I see things like that, it's gonna be wide open.
Why am I asking the location? Because a lot of times people will say, this is a sacral ulcer,
No,
right? Definitely it is. Or the sacrum across here. If it goes right down to the tip down here, it is not really the sacral ulcer. It's more coccygeal.
Coccygeal also.
The coccyx. This is a coccyx.
the coccyx.
This is this bone down here, and it's over the coccyx. And then it's leading into the anal area. Because the person is quadriplegic and they don't want to turn, it means that pressures are there. Unless pressures remove, regardless if you're trying to stop the feces from going there or not, the wound is not going to heal.
What about if they use a
Wound pressure ulcers will heal when we remove the pressure. The other problem that we have is that feces is infecting the wound, which is delaying the healing process. But the original problem is what?
He's not turning.
Pressure.
Because he can't turn, he's quadriplegic, and you don't want to want to turn him, cause him to get a breakdown. And he'll continue to get big if you don't want to turn. Because he should be on a turning schedule to get him off of that pressure area. The feces will make it infected. And this will delay healing. But the pressure continues, he's still lying on it, and to cut off the blood supply, and the wound will get bigger and bigger.
special to the
So he has a right, if you don't want it, then for the cities out of
time. It was special too.
But he makes his decision.
The fees is
He
not
want to listen to his wife, maybe got a lot of money,
Yes, life insurance.
so. Love is blind, you ever heard that term?
Life insurance.
Somebody call me?
All right, other rules that are associated with infections require IV antibiotics. That the same person might be having a infection because the feces going in there. They should be
Yes,
putting on a thick dressing with a plastic covering
yes.
to prevent the feces. All right?
The client is currently on the air mattress.
The type of thing he should be getting is one of those striker beds. A striker bed is one, very expensive, but you can rent it if they have the appropriate things. And the movement of the air inside is not water. right? We'll keep alternating.
Striker bed? Striker bed?
Striker bed. What different type of striker beds? You have in the tilt type, the type where you lie. It has the hole in there, around there. And you could tilt, you could sit up, to stand up, but they may not want to invest in that.
Money.
But trust me, I have technology for all that, for those people like that. If they got the money, he got the money, they're one of those beds. You know, in the facilities, the nurses like to call the board bed, because it's a big long bed, and the patient is on this alternating pressure mattress, meaning it don't stay, you know, when you put air inside of a mattress, it stays one thing, or you put water is one thing. You keep alternating, going down, coming up, going down, coming up. So there's no consistent pressure in one area. That's the only thing I could think that would be of help to
Striker. S-T-R-I-K-E-R?
S-T-R-Y-K-E-R, not
K-E.
Then Striker is just the name of the company. They have different type of beds.
Yes, they have solar
They
bed.
have a whole lot of different type of beds. The name of the company is Striker. All right.
And VK.
Won't require frequent dressing changes. Amputations. Neuropathic ulcers. Necrotizing fasciitis. Osteomyelitis. Peripheral artery disease. Venous stasis. Post-trauma. Burns. Vascular and arterial wounds. If you look at all of those there, you have touched on every one of these at some time or the other. At some time or the other, you've touched on every one of those. You might have even done, Barnes, the longest rule of 9, right? How do you estimate skin loss? Some you get for these two here, venous stasis, the peripheral artery disease, and the venous PVD, peripheral vascular disease, with stasis ulcers. Osteomyelitis will come, as we say afterward, and we'll get both problems. Right? Amputations, we talk about people toes get cut off, right?
Yes.
When they have diabetes, we call that transmet. Transmet. Why do you say transmet for the toes? Why do you say it's transmet? Toes are transmet arm.
For the two.
Because in the foot, where the foot is being cut off, you have the metatarsals. Now metacarpal, metatarsal. So metatar is that foot cutting off. Now state your normal anatomical physiology, make it easier. I tell you guys this all the time. Now you go into pathophysiology, you need to remember these things. Okay. Now, when they talk about our full range, they talk about the hospital full range. So we just go with the full range of service. We can follow national standards of care and research. That's what we involve with, national standards. And include but not limited to. So what you see here, there may be others. And the fourth thing we have there is surgical services and consultation, including what? Debridement. And we say, when do we use the debridement? When someone is fainting. The necrotizing tissue, the necrotic tissue that is preventing healing. So they have to what? Take it off, cut it off. There are daily physician visits and a wide scope of physician consults. Now, when they talk about daily physician visits, they talk about primary care doctor is there. But a wound care specialist, he comes once a week. The wound care doctor comes once a week. And then he will tell the wound care, the primary doctor, what he is going to be doing. So they can be on the same page. They also have a wound care nurse who's usually a rehab nurse. Okay? And And then acute care, I might have said a wide scope of physician consults. When the patient gets osteomyelitis, they may want to consult. Who? Who do you think they may want to consult now?
Wound care, doctor.
Who do they want to consult now?
the nurse.
Infection specialist.
There's a doctor who goes into hospitals, nursing homes, and what have you, and his specialty is infection
Control.
So we call it infectious disease. Infectious disease, an ID doctor, look it up please.
Infection disease doctor.
Infectious disease doctor, ID doctor. And you'll find when you're like a nurse and you're on that floor, you'll be dealing with this doctor, with this ID doctor. When you make some referrals and things, you see the
Infectious disease doctor.
you probably for any type of infection, you name it, called the ID specialist.
Say last. Give my ears a break. Treat illness anywhere in the body that causes microorganism.
This guy wondering, what's going on?
Well, first let me read it.
Yeah, who's infectious disease? So you guys know what we're talking about. Come on.
Your body, go ahead.
Go ahead.
No, you go ahead. No, go ahead. I insist.
Come on, go.
Your body is a home to a microbiome full of bacteria, pathogens, fungi, and viruses. Typically, they don't cause any harm, but sometimes microorganisms can cause disease. I'm leading to it. Just follow me, guys. Follow me, alright?
Let's hear what
You can also contract infections causing pathogens or parasites from other people, animal, insects, or contaminated food. Because of symptoms and severity often vary, infectious diseases can be challenging to diagnose and treat. Infectious disease doctors are experts that specialize in identifying and treating a wide range of these conditions.
Alright, pretty good. Thank you. Alright, so you guys heard there, right? So when the primary care physician, a lot of doctors will call the ID doctor because they don't know how to treat that patient. And they want to get a specialist. And the ID doctor is the one who specializes in infectious diseases. And so it's wonderful talking to these doctors. I had the opportunity of working with them on several occasions. ID doctors, as a nurse, you get an opportunity to talk with an ID doctor. It's very, very enriching and informative. And they're always willing to share, especially when they have a situation as a foreign in the unit. Talk with them, they're always willing to teach. That's one thing about these doctors, always willing to teach. Now, you have acute care levels, nursing staff services. What do you think you mean by acute care levels, nursing staff services? What do you guys think you mean by this? Acute care level nursing staff services.
It's pretty straightforward. He's talking about the nurses that are available when a person has acute cases of like wound care or whatever, until it becomes severe. Then they have to take it to the further, they have to take it to another level of care. But when the situation is acute, you have nurses that are available to help you at that stage of your wound care need.
Anybody else? Come on, I want some critical thinking. Fair or clear. Anybody else, what you think that means? Acute care level nursing staff services.
Saying they have nurses that available that speak to take care of the patient, like after they have their own staff.
Both of you are really close. Well, when you're talking about acute care levels, you talk about nurses who are specifically trained in specific areas of acuity. For instance, if a patient is on a vent unit, you have to have a staff who specialize in vent care.
Okay.
Patients who have ulcers, we want to have air, wound care nurse who specialize in it, not just a regular nurse to come and do dressing. So that is why they're meant by acute care level. Right now, if you do reading on why the nursing homes have moved from being nursing homes to rehab subacute facilities, it's because they have to make more money, and before they can make this money, they have to retrain their staff. They have to send the RNs out to train to take on acute, subacute cases, because acute cases are coming from where? The hospital. And the hospital is not doing what we have anymore. So all the IVs and so it's coming to the nursing home. So it's not a traditional gerontology or people nursing home. It's not people who are coming to receive rehab care to go home. So what mean? The staff now have to be
Acute care specialist.
They must be certified in areas and must be able to know what they're doing. So they can now train. This has happened over the years. So now you find when people come in, they already have some knowledge because they've got some teaching in the schools and during the orientation, they're trained to do certain things. Okay? Then identification and treatment of conditions that impede hearing. What conditions that can impede hearing?
Infections.
What conditions can impede hearing? Infections, yes, absolutely. What else?
Smoking.
Smoking. Not getting the right food, exactly.
Right.
Food to promote healing.
Just
What we were saying just now, patient education. Because as a patient, they say, I want to look at TV, I want nobody tell me. It means what? You have to teach the patient to understand the ramifications of those decisions. Okay?
if the patient is not combative.
You know what?
If the patient is not combative, in other words, they don't want to hear nothing you have to say.
If a patient is, we would not use the word combative.
Compliant? Compliant?
He's non-compliant,
Okay.
because that's what you're going to put. You have to indicate that you have provided teaching, that patient is not compliant with the teaching. Patient refuse to accept teaching sessions or patient education, refuse to be a part of, but you have to document it,
I know teaching them.
right? Because if it's not documented, you will never talk to the patient. And the patient's family could sue you later or sue the facility. Okay? So you need to document these things. Then you have home assessment and photo documentation. Now this photo documentation,
It's done by, yep.
yes, this thing used to be photo doc. At one time we used to take a photo, but you have to stop that. Right? Stop that photo documentation. There's a lot of legal things came about with that. Years ago, I remember, and the lawyers taking out pictures, and then guess what?
HIPAA.
Somebody had it all over
Facebook.
Oh, look at these nuts and ulcers and big stuff. Yeah. People get funny. Especially doctor's office with cultural specialized beds, and we just talked about
People are very smart.
state-of-the-art treatments and procedure. State-of-the-art procedures, treatments and procedure, again, that is very, that depends upon the facility, what they have.
The money.
Functional nutritional assessments,
We spoke about that.
assist wound healing, which you guys talked about. Also pulsatile, lavage, localized hydrotherapy.
Hydrotherapy is very good.
That's nice, right? Pulsatile lavage. Remember we did a lavage, we talked about what?
Yes.
Washing out the stomach, washing out the area. Hydrotherapy using water. But not the stomach you're doing that, this is a wound you're doing it, right? There's topical agents, that is various things you can put on the skin. Interdisciplinary team conferences with your family, and who makes up the interdisciplinary team?
The nurse, the caseworker, the dietitian, the doctor, the entire interdisciplinary team.
Who's in the entire interdisciplinary team?
I just called them out.
No, you call them out.
The dietitian, the nurse, the dietitian, the
Everybody who works in a hospital is part of the team.
Okay.
But the persons who are in the care plan meeting is not who you're going to identify. The persons who is in the care plan meeting will be considered to be there interdisciplinary for that patient. And should also include the patient. A lot of people call every name except the patient.
patient.
The patient is a member of the interdisciplinary team, and the patient has the biggest voice during the interdisciplinary team meetings, and or the family member who's a healthcare proxy. They have a say, they determine what's going to be done. The healthcare providers will work with them. So that's it to this work team. We have dietary, social services, good.
Physical therapy.
That's a rehab therapy. That's 3 days in the rehab. You have physical, occupational, and speech. They're all there. And now they have other people. You have these guys from marketing, who sits in there. You have recreation, but you have a specific group that comes from recreation. They come from corporate headquarters. And they're more like, they don't just deal with recreation, but they deal with talking to the family. What's the problem? Then you call the family. They are like advocates, but they are not term advocates. And they come directly from corporate headquarters.
What about the attorney?
The attorneys are part of the team. Attorneys there, all facility has attorneys, and they're there when something goes wrong, or need advice. All right, education for you and your IV antibiotics and in-house
Radiology, pharmacy, lab services.
Now it said creating an environment, what?
An effective care plan for complex wounds,
Creating an effective care plan for complex wounds and those that persist despite treatment requires a comprehensive understanding of the wound's etiology and any conditions that may impede or lead to complications, said Dr. Sean Mulder, Senior Vice President for the hospital. But what I want you guys to look at there is here. Create an effective what?
effective care plan for complex wounds.
I'm telling you this all the time, every day I tell you this, because that's what you are in every healthcare environment. You've got to know care planning process.
Thank you.
Everything has to be documented, and everything in all, whether it be a hospital, whether it be a nursing home, everything is documented in care plans. When you write a purpose note of a patient wants one, the purpose note is just to support what you put on the care plan, and say the patient is a combative patient. So now you have the supporting documentation in the purpose
I'm
note.
gonna send it to you
Okay,
on
guys?
WhatsApp, okay?
Which one to choose?
I'm gonna send it to you on WhatsApp. Hold on.
Damn, give me so much problem.
Now in a necrotic wound or a person with diabetes may require a very different treatment approach than an infected wound on the body of someone who is immunosuppressed due to
Check
chemotherapy.
your WhatsApp.
And what I mean by immunosuppressed due to chemotherapy? People who has cancer and they put them on chemotherapy, it will
Attack
make your
all
body
weak.
defenses become more weak. And those opportunistic diseases you talk about earlier, they will take advantage of those weak situations. So they will attack. and this is what's gonna
Did you
cause.
see I sent to you? Check your WhatsApp. Okay, type conditions wound care.
Just that you are
Alright,
receiving.
we're going to cover all this, success spotlight and Albert story, everyone with Albert
Thank
story.
you, Kindred. Don't worry, it's already finished, don't worry. It's too late, don't worry about it.
No, when I go home, I could go over it.
Now, the said treatment, and this is from the,
NCBI.
NICBI,
NCBI.
NCBI,
How do we
and
get
this is a .org.
I don't get the thing here.
NCBI dot NLM dot NIH dot GOV.
Look up there, NCBI.org/books, MBK, whatever.
Too fast.
Straight to the top. No, straight up there, look at it.
NBK 32 36
Down here, your government, the federal government website.
36.
I won't hear it.
Read it, yes, there, read it.
NCBI.NIH.org.
Enter.
That
I'm there. I got in.
this is COVID.
I got in.
And what this is dealing with chronic wounds.
Yes.
Just now we spoke about what? We spoke about the acute ones, whether it be open or
Or closed.
That's what the focus is on just now.
Just now.
So this here, on this government website, is dealing with
Chronic wounds.
chronic ones, things that's been around for a while. So that one, if we get first is acute, now we want to let's try to get through this as fast as possible.
Yes.
Now, what are the treatment options for chronic wounds? At first, chronic wounds are regularly cleaned and covered using wound dressing and bandages. If a wound still hasn't healed after a long time,
Trying to spare wound care. Special treatment such as
vacuum-assisted closure or skin grafts are used. Now, if someone has a wound for more than 8 weeks without any signs of healing, it's considered to be a chronic wound. You guys heard that? If someone has a wound for more than 8 weeks, which is what? 2 months,
Considered chronic.
this is considered to be a chronic wound.
Alright.
Now, these kinds of wounds usually arise as a result of poor blood circulation, diabetes, or a weak immune system. Open wounds on the lower leg are also known as venous leg ulcers,
Where are we?
as well as printing the underlying condition and
Intending to
tending
the
to wound.
pain relief is important.
Some people with complex, poorly healing wounds find psychological support helpful too.
Cleaning the wound.
So it is not just about the wound itself, you gotta think about the mental status of your patient.
It's considered
Now cleaning the wound.
the wound.
Let me just move this up so you can see, sorry about that.
Before NIH, what is
Clean the wound. The
NL?
wound is often cleaned when the dressing is changed.
Change. Normally using
Saline into a salt solution. Overall though,
What's your email?
not enough is known about the advantages and disadvantages of the solutions that are used to clean wounds
Wounds.
and how they affect the healing process.
Healing process.
It's also not yet clear whether tap water could be used for the medical cleaning of wounds.
So it's still being
So we're
experimented.
looking at that still, and I guess with time.
We'll find out. Not New York water.
Now, just for your edification, if you look where it says Goto,
Oh, I can get it.
Okay.
you see where it says clear the wound?
Let me help you.
Goto, the bigger the aggressive compression, all that sort of stuff.
Yeah.
Alright, and when you click on each one, it's going to give you more information.
Okay.
Are you guys with me?
Yes.
Alright.
Go to
Now, debridement.
type WhatsApp for
One treats chronic wounds. Doctors and nurses often remove dead or inflamed
wound tissues.
This
This is known as debridement.
The
Tissues removed using instruments such as tweezers,
a sharp screw-like instrument called a curette or a scalpel. An enzyme-based gel is sometimes applied to help clean the wound. And they use that a lot. The gel. The wound can also be cleaned using a high-pressure water jet. Another form of debridement involves the use of a certain species of
maggots.
maggot, which is a fly larva that are specially bred for medical
Purposes.
purposes. I know a lot of people got squeamish when they talked about it, to put the maggot in a person's wound. It will eat up the what? The dead tissue. The maggots are placed on the wound either as they are or in a pouch. They remove dead tissue and fluid from the wound. So you put a little maggot in, when they're nice and big and fat, we did what? They have all that stuff that will clean out the wound nights for you.
That's good.
Now, because debridement is often painful, the local anesthesia is used to numb the wound beforehand. For instance, using an ointment. If more severe pain is expected, painkillers can also be taken before treatment. Larger wounds are sometimes cleaned under general anesthetic.
Aesthetics.
There is not enough good research on the advantages and disadvantages of the various debridement techniques to be able to say how effective they are. Now, pain medication. On your care plan with the wounds, you will put that the patient will be having a debridement. And with the debridement,
You want to give
patient will be receiving pain medications prior to the debridement.
30 minutes prior.
And to be
30 minutes
prior. Whatever the medication is, will be administered 30 minutes before you touch the patient. So it will have to what? Numb the area so the patient will have less pain.
Pain, wow, yeah.
Now let's go to wound dressing.
Once the
Once the wound has been cleaned,
it is
it is covered with a dressing. Now most wounds are kept moist, for instance with moist compresses. But following kinds of dressings can be used instead. Films, gauze, hydrocell dressings, hydrolar dressings, dressings containing sulfur or arginates, and foam dressings. I think we have a few in the back here.
foam
And
dressing.
the dressings are used to remove excess fluid from the wound and protect it from
From infections.
They are usually left on the wound for several days. Dressing should be changed if it's clear that the patch soak up any more wound secretions. So of course,
Yes.
we have dressings that you put on, and
It's not yet
but
possible.
when you talk about debridement, and I think this is where you explain it. Debridement, you could have a surgical debridement.
Because there isn't enough good research in this area.
And you can have the manual debridement, which is the use of the wet to dry dressing. Because normally if you put all dressings on a patient and it gets dry, when you try to take that dressing off, what happens? It sticks. That's called mechanical debridement, sorry. So look that up please, mechanical debridement.
Look up mechanical debridement.
Because change the mention down there.
Mechanical debridement. Let's see. I can't find it.
Anybody from mechanical debridement?
Debridement. Wound debridement. Which one? Which one? Which one? Which one? There's no number.
Which are then manually moved because non-selective debridement of the body tissue and blood and sometimes healthy tissue as well.
Okay. So you heard what Sodi just said. And I'm just saying it is what? You're wet to dry dressing. And when you're removing it, it removes all that swab. But if you notice, for those who've done dressing, that sometimes bleeding occurs because it starts to take what tissue too. Right? So the wet to dry dressing is your mechanical debridement. The one that you use, a scalpel, is a surgical debridement. Now we're going to look at the third debridement. This is called enzymatic. Enzyme debridement.
How you spell enzymatic? Debridement. Enzymatic debridement. Definition. Define. Enzymatic debridements are a highly selective method of wound debridement that uses naturally occurring proteolytic enzymes manufactured by the pharmaceutical and healthcare industry specifically for eliminating devitalized tissue. I still don't get it. Enzymatic debridements.
Usually it comes and it looks like butter or tomato comes on top of a foil or a sheet that you can tie or you can put it into the wound itself. It eats up everything, but it's a different type of breaking down. Remember enzymes break down stuff, right? Changes stuff. So now what you do, I put this enzyme and it stops it.
I know.
Example. Put an example of enzymatic
Which one
enzyme.
is that for you?
This enzymatic
Which one?
enzyme.
Oh, you mean the website? Listen to me.
This enzymatic enzyme.
Go look at website for Windows.
That are used for
can take a part of the
You just read
process.
enzymatic enzyme. So listen,
Download that.
examples of it.
Very simple. Download it.
For the agreement, where's the agreement? You guys use it all the time, trust me. You use it all the time in the nursing home,
Enzymatic. Enzyme.
Guys, remember enzymes. Remember in the stomach you have enzymes, right?
Yes.
You have lipase and
Mayonnaise. Sucrase.
Amen.
Go ahead.
pancreas, you have enzymes
Let me in.
to break down the food. Now you have enzymes in the break down the
Go to your
fat
website.
that's in the womb, the slug, what have you. So that's a function of the enzyme.
Go to your WhatsApp. Before he catches you.
Yes, I can.
Go to let me help you. Settings.
Alright, let me give you one. What's a collagenase? Collagenase. C-O-L-L-A-G-E-N-A-S-E.
Something I hear before.
Look for collagenase. Look for the word collagenase.
Come on with this.
C-O-L-L-A-G-E-N-A-S-E.
Collagenase with a C, right?
Yes, I'm scanning.
That's all.
Somebody read, well, read. Sorry guys, one person read please. Who's reading? Come on.
Collagenases are enzymes that break the peptide bonds in collagen. They assist in destroying extracellular structures in the pathogenesis of bacteria such as Clostridium. It's too much to read, but I read the main idea.
It's the
Very good. Read out.
Collagenase is an enzyme that breaks down collagen and damage tissue with the skin and help the body generate new healthy tissue.
Okay, so that's what they use to review and all that fluffy stuff there, you put in collagenase, you get rid of it. Right? So there's two types of debridement. That's surgical, when it was a surgery. Then have the mechanical debridement, in which you put the electrical dressing. And then you have the enzymatic debridement, in which you use the enzymes. And the enzymes go and will break it down. You can also have another type. But that time that the other type is the one that they use in what? The maggots.
That's a different.
I would put a maggots just to eat, but this one with no maggots at this point. We're talking about the ones that are going to be doing going to see the state boards. But keep your back of your mind that in today's age, you're talking about using maggots, which is the kind of like, bring the maggots for this. The maggots are the larvae of flies, the same flies that we fly around the house. So the ones that before they turn to flies, they fly larvae. So they collect these larvae and they keep them and they're going to put it in people's foot because the flies or the baby flies need to eat. So what they do? They eat dead flesh. So when they eat the dead flesh, they kill out the wound and you are getting bigger.
I think that's the most effective way.
Okay, but remember guys, surgical, mechanical,
Enzymatic.
right, and the treatment to clean up the wound. I'm not gonna go forward with this at this point, because that we are running for you guys.
Go home.
Please do remember that
For the bereavement.
when you start talking about the wounds and wound dressings, you have to start talking about the acute stage,
Bereavement.
Chronic
on which we talk about open and closed
clothes.
wounds, the different types. Then I just wanted to teach you about what you should do if you are in the hospital, because certain things can be done in the home. Then you have just now looked at some chronic ulcers, and we say that for ulcer that's chronic, the time frame is usually an ulcer that we here for how long?
More than 8 weeks.
8 weeks, 2 months. Alright? That's in considered to be chronic ulcers. Now what you need to know now, if you're using any dressings, the clean dressings, right?
Yeah. Wash your hand, then clean it. Then, of course, you gotta put on gloves, but you know. Depends on the Nurse Practice Act.
Why are you not gonna put on gloves?
I don't support that. I don't support it at all. I'm saying, for me and mine, in this class, we put on gloves.
No, I asked you reason why you didn't put on gloves. I'm asking now. Who said that? Somebody said you don't put on gloves.
Some dogs don't. Like I speak that. They do dresses, they don't even put gloves.
You call them to look up something, I mean, a wound, they just like, oh, let me just, you know,
Yeah,
sometimes,
they might be professional. They might be seasoned.
Even they use the normal gloves they're not supposed to use, they have to use sterilized gloves to take it care.
You gotta send a clean field or a sterile field,
And they touch it,
depending on, you know what I'm saying?
Jesus' name.
You always gotta put on gloves. You gotta put on gloves before you clean. After you're done cleaning, you put on gloves, then you do the dressing, then you we gotta wash your hands first of all.
Yes.
Before you even start, you gotta wash your hands.
Some of them don't even wash their hands.
Wash your hands first of all, before you start. It's the first and universal precaution.
You guys can show it? Alright, so let's talk about it now.
Sure.
When in this classroom, you do all the standard practice, right? Not what you see. But I've been telling you guys all along that when people have already got their license,
They do whatever they want.
what they feel that they want to do.
They gotta drive, they gotta drive license. They gotta do what they want to drive.
Don't look at these people, I keep telling you guys out, don't look at anybody. Just do what you know it is right, and even if you see you're doing something wrong, try not to get involved because it might come out bad for you. But if it's gonna harm the patient, and most likely in this situation it's gonna harm the
They
patient,
will.
you know, you got a conscience. You gotta know what you have to do. I'm not gonna tell you what to do. Right? Because, people's lives. Because when a nurse or a doctor go and hold the wound and open it up, I'm not really concerned for the patient at that point. It's a nurse or the doctor who got it through their hands. And then what am I concerned, they're going to take their hand out and touch another patient. And that's where the HIs happen. They have care-acquired infections. But they are exposing themselves because they touch it and we don't know, God in heaven know what they're going to do. And we know although you wash your hands for 20 seconds, you have a lot of germs still in your hands. So I'm not worried about what they're doing with themselves. They know that choice, they want to do that. But if they go now and move straight up to another person and touch another patient, that's my concern.
What if they wash their hands right after?
If they wash their hands right after they do it?
Yeah, I think you can.
No.
You should not.
Guys, remember, when you wash your hands, it is not as effective as using your hands
Hand sanitizer,
in nursing, in healthcare.
any health setting.
Washing hands is when you're home. When you're healthcare setting, you use sanitizers. It kills 99 point whatever
Right.
of microorganisms. When you wash your hands, you do not wash away all those germs. Don't go by what I say, look it up.
I don't even wash my hands no more. I just sanitize everywhere I go.
Hand washing is merely operating your cart, and if you notice throughout the buildings, you have what? Hand sanitizer
Everywhere.
all around the truck and right? And there's another thing they say, after 3 hand sanitizers, you wash your hands proper. They only wash the hands if you feel that they're too sleepy.
It is.
I'm not saying
8 o'clock
wash
in the
to
dark.
wash your hands, hell no. Unless your facility put that in, as part of the policy, then you follow it. But there is no CDC guideline that say that's what you should do. Okay? But use hand sanitizers in front of washing the hands. especially in healthcare institutions where you, because many hospitals and nursing homes, you have sick people. And where you have sick people, it's a reservoir of what? Different diseases, different microorganisms. And remember, all microorganisms are not the same. Some is going to respond to certain things, others will not. So you want to use the clean hand sanitizer they have over there, that will kill it. And two, when you put on hand sanitizers, just like surface cleaners, it will tell you if you wait for it to be dry or not. Because it's just like you use a surface clean to clean surfaces and clean your glucometers. If you use it right away, the instrument is still what?
This was sent on the 4th.
Contaminated.
The 4th of
You
March.
gotta wait until
Nobody was
that time period, if it's 2 minutes in the bottle, you have to wait 2 minutes, because 2 minutes is when it's gonna die. Before that, it's not gonna die, it's not there.
That's
So they choose to use their bare hands, that's their problem. Now today, we're supposed to have done,
That's reportable, actually.
it's not supposed to be portable. Somebody will have their hands,
They were in the bare hands to touch the
they will be reported to us.
Department of Health.
You do not report anything outside of your facility unless you find that there is a problem, that the people in the facility who's supposed to take care of the problem is not doing anything, then you report it. And if you don't go call, I am Johnson, you said, I work at
Yeah, we said
every building, every facility, regardless of hospital or nursing home, have to have DOH hotline. And all you do is report into the hotline. You don't have to give name, you don't have to do all that sort of
That's right, whistleblower.
But the most important thing that you should know is if you see something before you go to the hotline, in every facility there's somebody called infection control preventionist, which is a nurse. And that is the person who's responsible for all those infection control procedures in the building. So you call, you ask the infection control preventionist and say, you know what, I see the nurse or I see the doctor using their hands, and then she will know what to do. Okay? And then if you see the still continuing and she's not talking with them, then you call DOH. Okay?
Not for
That's the procedure you use. You do not go outside of your facility to report things.
They don't have.
Don't do that. Okay?
Definitely. I can't buy another one for you.
Okay. Now I want you to make bandages. For cleaning, bandages used for cleaning. Hold on.
Bandages used for cleaning. I see nothing here but bandages.
What'd you say?
Bandages used for cleaning.
Okay.
Alright. Bandages used for cleaning.
Turn the light next to you, please.
Oh snap. That's pretty cool.
Did you guys find it?
No?
No, you're not supposed to do it because you're not going to have bandages used for cleaning. Now I'm looking for Dermasin, please. Dermasin, D-E-R-M-A-S-Y-N.
DERMASYN
/AG.
/AG. G as in grumpy?
Yep.
Alright. Dermasin AG gel.
Dermasin.
AG gel. See a picture.
You found that?
Antibacterial.
Of course. It's your silver dressing. Nothing come under silver nitrate. Right, the silver antibacterial gel. Hold that one here. The second one you go, guys, hold me please.
Yes.
The first one. The second one you're gonna look for is active skin repair.
Active skin
Active skin repair. And this will come under Born Hydrogel.
hydrogel.
Active skin repair. On that.
Yep.
Under that you're gonna see Born Hydrogel.
Okay. Got it.
Just find it and seek it. I just want to find it because that's what the question on the
S-Y-N, right?
So we're gonna focus on next week.
What is it?
Active skin repair hydrogel and Dermasin AG.
Send this to me.
active skin repair.
S-E-N or
SEN.
S-Y-N?
Look at it.
All right.
Are you gonna send it?
The form that you look for.
Of course.
In dressings, sometimes you have to put packing.
In dressing is one word?
I said in dressings, I didn't set it right here.
Oh, okay.
In dressings, or in wounds, right, you put packings.
Yes.
So the packing you're looking for is the iodoform. Iodoform. I-O-D-O-F-O-R-M, packing strip.
Packing street.
Iodoform,
Packing street.
packing strip.
Iodoform. Iodoform.
Packing.
Packing stripe. What I'm saying to everybody.
Number 4. Baby guys, number 4.
Too fast. I won't take time to do this that fast. I'm still on the... Hold on, I'm trying to coordinate everything.
The second one I don't hear it. I have the iodoform.
Iodoform gauze. Packing strip.
You guys, Mr. what's his name? Mr. Akia.
IKEA.
And he's saying loudly what I'm telling him. And if you guys have been following with that also,
Iodoform packing strip.
I have the second one. The second one I don't have.
I got you. I'm sending it to the WhatsApp anyway, everyone. Don't worry about it.
Stop. Listen. The very first one I gave was
Dermasin AG.
The second one I gave to you guys was here. Active skin repair.
Iodoform. Hydrogel.
The third that I gave was an iodoform
Packing strip.
packing strip.
All gauze, right?
Iodoform packing strip. And now I'm going to the fourth.
I'm gonna send it to
And the
the next
fourth
one.
is a calcium arginate dressing.
Calcium arginate dressing.
Calcium arginate dressing.
How you spell arginate? Arginate dressing.
Alginate. Alginator.
What is calcium arginine? Calcium
La prueba.
arginine. Oh my goodness, this guy is too fast. Why is going so fast?
Is the Dynarex, D-Y-N-A-R-E-X.
And then
D-Y-N-A-R-E-X. Dynarex.
D-Y-N-A-R-E-S.
X.
Thank you. D-Y-N-A-R-E-X.
View that sees something, V-I-E-W. A view guard.
I-E-W.
Dynarex View Guard.
Dynarex View Guard. View Guard is one word, right?
2 words. Dynarex View Guard.
Guard.
And this is a transparent dressing.
I like that one. That's my favorite one. Sure, see, it just goes right on the skin like that.
Or which one she said?
Dressing?
Dynarex. Dynarex View Guard. Study for Monday. Doing a test. I'm joking.
You shut up.
I will shut up.
He's gonna send it.
No, but collect your
Calcium
too.
arginine.
I'm gonna send it.
La prueba.
I'll send it.
Next is hydrogel.
Hydrogel.
Saturated gauze.
Saturated gauze. How do you spell gauze? I got it. Just want to make sure you are paying attention. Saturated gauze. Hydrogel saturated gauze.
That's what, 60 bucks?
Yes, that's enough. Hydrogel saturated gauze.
I know what is it. It's a piece you put in the wound and then it's
Alright, the
keep it
final one
dry.
I'm going to give you for tonight will be your tender band. N-D-E-R, tender band.
Tender band.
T-E-M.
D-E-R.
Border gauze dressing.
Border
Border like border.
gauze
That's what it calls, border.
dressing.
Border gauze dressing.
Tender band. Border gauze dressing.
Border gauze dressing.
Border.
G-U-A-D.
That's right.
Send those things.
We'll see. Tender
Tender band, border gauze.
band. Border
Border, D-O-R-D-E-R. Border gauze dressing.
Okay. Tender band. Border gauze dressing. Border gauze dressing. Border gauze dressing. How do you So how many are together? 7 or 8?
Then teacher, another one.
Calcium arginine dressing.
Alright, you guys finished writing?
Nope. The form.
I'm only here in the PSA no. Everybody else, have you finished writing those numbers?
It's 7, right? It's 7 altogether. Let me count. 1, 2, 3, 4, 5, 6, 7. Yeah, it's 7. The first one was Demerson. Alright, number 7, son. Number 1. Usual dressing. Number 2. Number 2 was active skin repair, hydrogel. Alright, that's number 2. Okay. Number 3 was Iodoform Gauze packing strips. That was number 3. If I'm looking at it now. Okay. Number 4 was calcium arginate dressing. That's number 4. Number 5 was Dermarex View Guard transparent dressing, right? Dermarex View Guard transparent dressing, alright? Next one. Yeah. Dermarex View Guard transparent. Oh, I'm not done yet. I will resend it. I'm not done yet. I didn't finish. Not finished. I'm gonna redo it. Number 6. I'm not finished. Hold on. Alright. Next one is hydrogel saturated.
All who have had 7, just raise your hands. Who have 7?
I have 7. If it's right, I have 7.
Then we have hydrogel saturated gauze. And then number 7 is
So let me just quickly talk to you guys.
tender board gauze dressing.
Last week, persons had assignment, right? And the assignment was 2-part assignment. Persons came yesterday, we did that 2-part assignment for those who came in at that time. So I could bring it every time I was listening. Now, you have some treatments, 7 treatments, 7 different types of treatments. The objective of me giving you those 7 is for you to do a research on those 7. Because yesterday, when we were doing the presentation, some persons, I don't want to say most persons, but some persons miss what they were supposed to be talking about. They missed the point because they did not read it properly, right? Or persons went on to talk about the disease and not what was the nursing, what help was needed that the patient is supposed to get. Thereafter, I showed you guys what you need to do. The 3-part: introduction, body, and conclusion. Whenever you're doing any type of research, you always do an introduction, a body, and a conclusion. An introduction is whereby you're not going to be plagiarizing, like yesterday, taking all the words and not understanding, because you don't want to understand to write your introduction, right? So you have to write your introduction, and then you go to the body. Talk about the effectiveness, situations where they're used. And if you looking at this now, you see how they went about talking about open, close, chronic. You're going to do, whatever you do with these, this is a pharmacological approach. Because before you get onto doing these dressings, you must have what? A a knowledge of why you're doing it and what's the effect of these medications. And these that you have to look at will give you not only dressings that is related to enzymatic, it also gives you an insight into filling of sinuses. So, next Monday,
Open it for me.
those 7 that you brought, I need your review on those pharmacological dressing treatments. Like how you said, all of 7. All of 7. No,
Exactly,
you want 7.
sir, exactly what are you asking of us to do? You want us to write about each one, or you want us to write down a dressing that is done with each one?
No.
It's a little confusing.
Why is it confusing? You are given 7 medications. You are given 7 treatments. Right? You're asked to write or research on these 7. And that research will indicate what is being used for. Why is it being used?
Going on this cabin job.
So you go in with these here,
On Monday.
I would assume that you would what? Break these 7 down into the different categories that they fall into. And then when you break them into, this in your research, into categories, and then you get your categories, now you can do what? Write about what each category is supposed to be doing. So X, Y is used for GBB, whatever. And treatment can also be continued. This is, all right, yes, go ahead, ask your question.
The all 7s are for only one purpose, for words, all the words you gave us. You don't understand what I said?
I understand what you're saying.
Okay, it is for one purpose only, for words, right?
What type of one?
So, you said we have to do research for each of them.
Yes.
So which is gonna be
7 pages.
7 what?
7 pages of homework.
No!
It's gonna be, because you said we have to do introduction, body and conclusion for each of them.
You could give a small amount if you want.
No, he wants us to talk about each one of those.
Let me add 7 and I will say that this is the last time I'm going to say it. That's 10 minutes.
Okay.
You have 7 drugs. All that are used in wound care.
Okay.
You have to do the research in these drugs. And you put them into the necessary categories as you do your research. And based on your findings, is how you're going to approach it, whether in your introduction, that XYZ is utilizing whatever. Okay? And then now when you go into the body, you're now going to be talking more in depth about it. And then finally going to conclude it about what is the effect and possibly whatever. As an old guys, come on. We went through this yesterday. This is the basic thing. Take this. That's why you do research. Research is a crime. So at the end of the day, you will know something about 7 drugs. Not you do one.
That's right.
Everybody knows 7 drugs that are used for topical treatment. And the categories they're in, and why we use it.
Okay.
Not one person coming and saying, well, no. Understand, read it, put it together, but it's not like how you guys did the one before, and which person just told me right to put it.
You do it.
I want you to understand it now, and use how the college paper, introduction, body, three, not very long, just three lines something. By the end of the day, saying exactly how to do the hands-on or the practical, you know what you're about.
That's right.
You just do the PowerPoint.
Okay? You know PowerPoint. Alright, that's a PowerPoint. I'm sorry to put the short paper, no PowerPoint. PowerPoint is a teaching practices. You're not doing no teaching. You're doing no research work.
And safe, it's like you do like this.
Okay, so fire safety, what we talking about? Fire